Hey, Josie, so talk to us. What's one piece of advice you can give us this Monday morning?
Oh, I'm so excited about this. My piece of advice is that your number one customer is absolutely your team over your patients. And I know a lot of dentists probably panic when I say that, but we spend a ton of time and effort and energy on marketing and taking great care of our patients. But when we take great care of our team, that's going to translate to great patient care. And today I'd actually like to talk in particular about recruiting and retention of hygienists. Having been a hygienist myself, been a hygiene director, I've been a COO of a dental group. And what I will tell you now as a coach helping people across the country is that every single one of the clients that I work with, they are struggling with finding and retaining dental hygienists. And what I find is that a lot of people typically use COVID as an excuse. They'll say, oh, COVID happened, it shut the world down, and we saw hygienists leave the profession. And we know that about 10% of hygienists did leave the field, and I think that that's really unfortunate. But now what we hear is that people just say there's just not any hygienists available. They just don't want to work. They don't want to be in clinic. And what I would say from being a hygienist and being in the hygiene community is actually that hygienists do want to work. They do love clinical, but the reason that we've seen some of them leave the field and the reason that we see a lot of hygienists who have chosen a permanent job as temping is because we have a leadership crisis. And what I mean by that is hygienists are choosing not to work in your company because you're not leading them in a way that is meaningful to them.
Okay, got you. So then, what specific leadership behaviors have you observed that push hygienists and team members to leave? And how can practice owners correct these behaviors before losing valuable staff?
Yeah, so I have a very simple framework that I find works really well for you to remember when you're thinking about leading. And that is connect, measure, coach. And so what I mean by that is to connect with people in a meaningful way. And I mean, trying to get to know them as a human being, understand what's going on in their life, even taking time to find out what their dreams and their goals and their aspirations are. So that's connect. Measure is how do we appropriately measure success? And that includes utilizing key performance indicators or KPIs. But with hygienists in particular, sometimes they're afraid of numbers and metrics. So they feel like if a practice is asking me to be a high producer or to track my numbers, that means that they care more about money than about patient care. And so what you have to do in helping hygienists understand metrics is you have to connect those metrics to patient outcomes and to clinical care. And you also have to teach them a little bit about the business of dentistry, because when they have a greater understanding and they know how these numbers fit in, they absolutely will engage and appreciate those numbers. So there's a special nuance into introducing numbers and metrics. And the last one is coach. I love the quote by Dan Sullivan that he says, people don't want to be managed, people want to be coached. Our team members, whether they are hygienists or not, have a very different expectation in what they want from us as employers and in our work environment. And they want to be coached. It is not just about their job, it is about their life. And so we need to coach people up into a position. So maybe I'm a front office person and I'm growing into a manager position, or I'm a hygienist and I'm going into a hygiene lead. That's up. In my position is primarily what we do in dentistry is we're helping people achieve mastery over time. But so many hygienists feel like there's a very short ceiling to their career. I will tell you, I left clinical because I thought there's nowhere for me to grow. And yet I was motivated and excited about advancing what I did as a clinician, but I felt limited because my doctors did not actually engage in the same CE or passion that I had for prevention or treating periodontal disease. So providing a pathway to grow. And then sometimes, Michael, we have to coach people out of our business because sometimes our business outgrows our people and sometimes our people outgrow our business. For those of you who are especially getting started in dentistry, some of you have this expectation that I'll graduate from dental school, I'll have my practice, and I'll find this amazing team, and this amazing team is going to be with me forever. However, lifelong employment is a thing of the past. And a lot of people don't grow up as a little girl or a little boy dreaming about answering the phone at a front office. And so we have to just know and recognize that people are going to come and go in our business, and our relationships don't have to be dependent on an employment agreement. So again, connect in meaningful ways, measure performance, be very clear what your expectations are, and then coach people up, in, or out, knowing that sometimes it is better for them in their life to move on. And that doesn't mean we can't still remain friends.
How would you connect in meaningful ways?
Great question. So we actually have a framework that we've developed after working with literally thousands of employees and helping hundreds of managers grow. We call it the 5 Ps. And that is the various different parts of their life where we will have people take a look at these 5 important critical areas of their life and challenge them to set a vision for themselves and then also to set 90-day goals. So a very specific example is we have one of them that's called power. And power is my physical, mental, and spiritual health. And it's encouraging people to have healthy habits for how they take care of themselves. In dentistry in particular, one of the saddest things that I see is when clinical careers are cut short due to different musculoskeletal things or injuries. And so are we encouraging our people to have regular habits of exercise or mindfulness or whatever that is? And so we have a framework that we have people fill out what their goals are. And we sit down within the first 90 days of employment and we go through that and we just get to know our people in a meaningful way. And then we check in on them occasionally about every 90 days on their goals. So some people, it makes them feel really uncomfortable to think, am I really going to ask my people about their personal goals? And the answer is yes, you are, because they are a person with dreams and goals and aspirations. And the more that you understand who they are and what's important to them, the more that you can connect those goals to what the business goals are. And then we can win together.
So you said there's 5 Ps, right?
Yeah. You want me to go through all 5?
Yeah, real quick.
That'd be great. So the first P is purpose, and that is like your personal why or your personal core values. And so this one is probably the toughest one for people to define a vision for themselves or their 90-day goals. But what I have seen after working with so many incredible entrepreneurs, and I'll speak to you as the owner dentist for just a second, is dentists have been successful their whole life. They probably did well in high school and got great grades. They got them into college, and then they did well in college and they got into dental school. And then they get out and they buy a practice. And so often I see people attach their personal worth to their practice. Mm-hmm. And yet the practice is going to struggle. Not if it's going to struggle, it's when it's going to struggle. So things like struggling to make payroll or having a team walk out or not being able to fix, marketing, your practice is going to struggle, and you have to have a purpose in your life beyond what your practice is. So that's what we help people do in purpose. The next one is people. So people is about relationships, and our relationships really are the greatest indicator of longevity and health. And what you will find is that when you're struggling in your relationships, whether it's with a spouse or a partner or with kids, or your people are, they're not going to show up as a 10 at work. And so how can we encourage people to take care of the people that they love and to have positive relationships? Number 3 is power, which is physical, mental, and spiritual health. The 4th P is prosperity. And so prosperity is going to be, it might be wealth, especially for you as a practice owner. But for some of your team, prosperity might be more autonomy of their time. Or it might be saving for something like a house or a car or preparing for something in their life. And then the last one is performance. And that's what connects this personal stuff to the professional stuff. So performance is how are we doing in our job? How are we performing in our position? And that is a critical part of having this whole life. We talk about how everybody has one life space. And if we're not minding those 5 different areas, we will struggle. Now, I'll quickly say, we hear a lot about burnout. Mm-hmm. We hear a lot about overwhelm. And most people are blaming that burnout and their overwhelm on work, on what they do on a day-to-day basis. And they're quitting their job and they're hopping around searching for greater work-life balance, which is a lie, right? There's no work-life balance. It's work-life harmony. And what I find is actually that burnout may not be happening from what we do every day in the dental office. It may be because I'm not minding my relationships, or I'm not taking care of my physical health. I'm not in alignment with my personal values, So what I find is as you utilize these 5 Ps and helping people set goals, long-term and short-term, you might find that there's decreased overwhelm and burnout because they're actually taking better care of something that's going on in their lives.
Interesting. So I feel like that's so complex though, Josie. Every 90 days, do you follow up and be like, where are we deficient on which P? Because I feel like it would always change, right? Every level?
It absolutely changes. So first of all, if you are a manager or a practice owner, it is not your job to ensure that your employees are checking off the boxes and achieving their goals. So you're not going to like, hey, you set a goal of saving $5,000. Why are you still getting Starbucks every day? That is not what we're going to do. It's actually just about creating a safe place where people can verbally share their goals and feel as though they're seen as a human being. And so I do it once a year. I'll really just dig deep into their goals and I'll ask them questions. Then every 90 days, I recommend doing what we call a quarterly check-in. That is a structured conversation where we use this idea of connect, measure, coach. And on that connect part, I just simply say, how are you doing on your goals? How are your 5 Ps? You said last quarter you were going to call your mom once a week. How's that going? So I check in so that they feel heard and seen, but it's not my job to track, to manage, to ensure that they get it done. It's really just about seeing and knowing who they are. And it's incredible the experience that the employee has. I've had many people come back and say, I was shocked, Josie, how many tears there were. And not that it was tears of sadness or discomfort. It was that nobody had ever asked them what their vision for their life was.
Yeah. No, that's interesting. I like that a lot. It opens the door a little bit more. So, Josie, in your experience, how do leadership blind spots in practice owners contribute to team frustration and disengagement? And how can owners uncover and address these blind spots? Would it be doing this?
This is one great way to absolutely uncover those blind spots. I think that in many ways, before a dentist and a practice owner, so much of what is happening is about achieving our goals. The practice is this is my business, my dream, and everybody's helping me. And that's actually not what most employees are excited about, is helping you build your dreams. They want to build their own dreams too. They want to help you win, but they also want to win. So I think that that is a blind spot that sometimes we can be very self-centered as an entrepreneur. And that is not shame or judgment. I am an entrepreneur myself and totally know where that comes into. But the other blind spot that I would say is that we just don't have a good system for this. And you need a good system for leadership. And so I'm sure if you're listening to this podcast, you're probably also a pretty avid reader or listener to other podcasts. And there's incredible people who talk about leadership like Simon Sinek or John Maxwell or Ben Hardy. There's all of these authors that we love. But how do we take the idea of what it means to be a leader and how do we actually execute on it? And that's where you need a system. And I think that's what I've spent the better part of the last 10 years of my career doing, is how to create a systematic leadership approach, meaning how do I do this connect, measure, coach, but how often should I be meeting with my employees? What should we be talking about? How do we have difficult conversations? And how do we align with what I need in the business and what you want with your life? So I think that one of the blind spots is there's not a good system, or there hasn't been a good system. And that's what we're trying really hard to build.
I like that. I like how you mentioned, how can I ask these difficult questions, talk to the employee? Like, just for example, when you're approaching them and asking them about, did you call your mom this week, kind of a thing, right? It's kind of weird asking your employee, right? So I guess, how can owners or leaders, right, balance vulnerability with authority to foster a culture of trust and support, especially during times of high stress or change?
Yes, I love that. That is the constant need of how we do. I love that you called it out, vulnerability and authority. What I share is that I want to help you create an environment of high love and high accountability. A lot of people think those are two things on the opposite end of a spectrum, but we can have high love and high accountability. Now, there is absolutely an important nuance, and that is that I can love and care for you as a human being without being your buddy, where it's like not appropriate for us to go out on the weekends together or us to go on vacation together or doing things like that. There absolutely has to be a professional line in how much we're sharing our life. But I do think that vulnerability allows other people to be vulnerable. So A specific example is where business owners or managers feel like I have to have all of the answers and I can't tell people that I'm struggling. And yet, when you're real about the struggle or real about the fact that you don't have the answers, it actually gives your team permission to do the same. And we create an environment where it's greater partnership and we work together. So there's absolutely a nuance in understanding who people are and what motivates them and not getting like too involved in their lives, right? Not inserting ourselves or feeling like we know too much or ask too many questions.
Awesome, Josey. I appreciate your time. And if anyone has further questions, you can definitely find her on the Dental Marketer Society Facebook group, or where can they reach out to you directly?
So my email is just josie@joseysewell.com. Make sure you spell it right, JOSEYSEWELL. And then on any social media platform, you'll find me at Josey Sewell. Really happy to answer any questions that you might have on how to create a healthy, happy team.
Nice. So that's going to be in the show notes below. And Josey, thank you so much for being with me on this Monday morning episode.
Thank you.